Let me start what's happening in Australia. So first of all, and this is important because I'll go over a few different countries and explain the writing on the wall. According to data published by the New South Wales government, NSW government unit on COVID-19, more vaccinated Australians are hospitalized for the virus than the unvaccinated ones by a large margin. I'll explain. It revealed on January 9th, and this is bigger if you understand the vaccination rates. On January 9th, 68.9% of COVID patients aged 12 and over in hospitals had 2 doses of the vaccine, and only 28.8% of those in the hospitals were unvaccinated. Now, this includes a higher rate of people in intensive care units, the ICU. 50.3% of people in the ICU for COVID-19 are people who are vaccinated. 50.3%. And let me explain the breakdown on this. When the vaccination rates in New South Wales population are factored in other words, you go by the number of people vaccinated versus unvaccinated, this shows that the unvaccinated people are 6 times more likely to be hospitalized. 6 times more likely to be hospitalized, going by the numbers there, and 13 times more likely to be sent to the intensive care unit for COVID-19. So all this narrative about, yeah, you get the vaccine, it's not as bad. The data does not show that, at least not on the official government data out of New South Wales and Australia. And Australia's had some of the harshest policies on COVID in the world, meaning that this is by no means some, conservative talking point or something like that. Some of the strongest policies in the world, and that's the data coming out. In Britain, another example of this. Meanwhile, the former chair of the country's virus task force, Dr. Clive Dix, who is not an anti-vaxxer. This guy, Dr. Clive Dix, he helped pharmaceutical companies create the first COVID-19 vaccines. This is a guy who helped them make the vaccines for COVID-19. He told LBC Radio on January 16th, just recently, and this is his quote, "The Omicron variant is a relatively mild virus, and to just keep vaccinating people and thinking of doing it again to protect the population is, in my view, now a waste of time." In other words, the booster shots are a waste of time, according to the guy who helped the pharmaceutical companies make the vaccines for COVID-19. Bill Gates looks like he agrees. He wrote on Twitter that the Omicron variant of the CCP virus may bring about enough natural immunity. He didn't use the word natural immunity, but he suggested it. I'll explain. May bring about enough natural immunity in communities as it passes through that it may end the outbreaks, at least seasonally. But he's also not getting off the vaccine agenda, I should note. Instead, he's calling for annual or regular vaccinations. And this is Bill Gates. He said, quote, "Once Omicron goes through a country, then the rest of the year should see far fewer cases, so COVID can be treated more like a seasonal flu." And he also stated the vaccines we have prevent severe illness and death. Data does not show this, but that's what he's saying. The vaccines we have prevent severe disease and death, but very well, but they are missing 2 key things. First, they still allow infections, breakthroughs, and the duration appears to be limited. We need vaccines that prevent reinfection and have many years of duration. Dr. Fauci is following a similar narrative on this, and I'm going to show you something interesting in just a bit. He's now saying that just about everyone is going to get COVID-19. This is Dr. Fauci, the guy who's been saying, go get the vaccine so you don't get the virus. Go get the vaccine so it's not as bad. He's now saying everyone, just about everyone, is going to get COVID-19. That means whether or not you are vaccinated. He said during a talk held by the Center for Strategic and International Studies, and this is his exact quote, "I think in many respects, Omicron, with its extraordinary, unprecedented degree of efficiency of transmissibility, will ultimately find just about everybody." European Union regulators they're now warning that frequent booster shots, get this is the European Union. This is Bloomberg News. This isn't some fringe web. Well, maybe you consider Bloomberg fringe, but Bloomberg News is saying European Union regulators are now warning that frequent booster shots for COVID-19 could actually damage a person's immune system. You hear that? So rather than recommending booster doses every 4 months, they're recommending that countries give people more time between boosters and also tie them into the cold season each year, like the flu. This is far from that. So this is from the European Medicines Agency. And Marco Cavalieri, the EMA head of biological health threats and vaccine strategy, said at a press conference, and this is according to Bloomberg, that booster shots, quote, can be done once or maybe twice, but it's not something that we can think should be repeated constantly. On the grounds, again, that their data in Europe, on the European Union, and this is official reporting, this is from the European Medicines Agency, one of the officials there on this stuff, Bloomberg News reporting, saying that frequent booster shots for COVID-19 could damage your immune system. And they're saying don't do it more than once or maybe twice. So not every 6 months, maybe not even every year, because it could damage your immune system, according to this report, according to the official body on this in Europe.